Hello, welcome to BEH 217 Behavioral Approaches. Today we're going to be talking about the essential skills for a therapist. So, the best skill, the most important instrument is you. And by remaining open to self-evaluation, you not only expand your awareness of self, but also build the foundation for developing your abilities and skills as a professional. If we hide behind the safety of our professional role, our clients will likely keep themselves hidden from us. If we strive for technical expertise alone and leave our own reactions and self out of our work, the result is likely to be ineffective counseling. Who the psychotherapist is directly relates to is his or her ability to establish and maintain effective therapeutic relationships with clients. By modeling authenticity, by engaging in appropriate self-disclosure, our clients will tend to be more honest with us as well. Research indicates the significance of the therapist as a primary factor in successful therapy. The attributes of the psychotherapist are inextricably intertwined with the outcome of psychotherapy. Clients place more value on the personality of the therapist than on the specific techniques used. Techniques themselves have limited importance in the therapeutic process. Wampold conducted a meta-analysis of many research studies on therapeutic effectiveness and found that the personal and interpersonal components are essential to effective psychotherapy, whereas techniques have relatively little effect on the therapeutic outcome. The contextual factors, the alliance, the relationship, the interpersonal skills of the therapist, the client agency, therapeutic factors are the primary determinants of therapeutic outcome. So, in terms of what it takes to be an effective counselor, there are specific characteristics. Now, few therapists fully exemplify all of the traits described in the list below, but it is a list that is intended to help you to examine your own ideas about what kind of person can make a significant difference in the lives of others. So, effective therapists have an identity, respect and appreciate themselves, are open to change, make choices that are life-oriented, are authentic, sincere, and honest, have a sense of humor, make mistakes and are willing to admit them, generally live in the present, appreciate the influence of culture, have an interest in the welfare of others, possess effective interpersonal skills, become deeply involved in their work and derive meaning, are passionate, and are able to maintain healthy boundaries. Think of these characteristics with the goal that you will examine and develop your own concept of what personality traits you think are essential to promote your own personal growth as you engage in psychotherapy. A review of research studies on the outcomes of the psychotherapist's own psychotherapy revealed that more than 90% of mental health professionals report satisfaction and positive outcomes from their own counseling experiences. Orlinsky and colleagues suggest that personal therapy contributes to the therapist's professional work in the following 3 ways. Number 1, as part of the therapist training, personal therapy offers a model of therapeutic practice in which the trainee experiences the work of a more experienced therapist and learns experientially what is helpful or not helpful. Number 2, a beneficial experience in personal therapy can further enhance a therapist's interpersonal skills that are essential to skillfully practicing therapy. And number 3, successful personal therapy can contribute to a therapist's ability to deal with the ongoing stresses associated with clinical work. For those of you who may remember the TV show The Sopranos. One of the brilliant pieces of this was the fact that the mob boss, Tony Soprano, had a psychiatrist, Dr. Melfi, and Dr. Melfi also had a therapist that she would go to see to discuss the fact that she was working with a mob boss. So it is not unusual for therapists to have their own therapy, and it is pretty much essential for a student who wants to be a therapist to engage in a therapeutic experience so they can see what it's like from the other side of the chair. By participating in personal therapy, counselors can prevent their potential future countertransference from harming clients. Countertransference includes any of our projections that influence the way we perceive and react to a client. This phenomenon occurs when we are triggered into emotional reactivity, we respond defensively, or we lose our ability to be present in a relationship because our own issues become involved. Recognizing the expressions of our countertransference reactions is an essential step in becoming competent counselors. Unless we are aware of our own drives, we are not fully available for our clients. There's a common statement called healing the healer, and that's what really personal therapy does. It's instrumental in healing the healer. If we are not committed personally to the value of examining our own life, how can we inspire clients to examine their lives? Our own therapy can help us to develop patience with our patients. As we increase our self-awareness through our own therapy, we gain increased appreciation for the courage our clients display in their therapeutic journey. So it's that old saying of walk a mile in someone else's shoes. So once you engage in a therapeutic relationship, you understand what the intensity is like. Our values are core beliefs that influence how we act, both in our personal and our professional lives. Personal values influence how we view counseling and the manner in which we interact with clients, including the way we conduct client assessments, our views of the goals of counseling, and the interventions we choose. We must strive to avoid being stuck in our own worldview. We need to guard against the tendency to use our power to influence clients to accept our values. Persuading clients to accept or adopt our value system is not a legitimate outcome of counseling. The counselor's role is to create a climate in which clients can examine their thoughts, feelings, and actions to empower them to arrive at their own solutions to problems they face. The counseling task is to assist individuals in finding answers that are most compatible with their own values. Managing your personal values so they do not contaminate the counseling process is referred to as bracketing. Counselors should not refuse to render services to clients because of differing values. So, for example, one of the big conversations that have occurred over the last 10 years or so is this idea of conversion therapy, whereby some counselors believe that homosexuality is not a naturally occurring phenomenon, but something that can be quote-unquote cured. And despite all of the scientific evidence that homosexuality occurs naturally across species, they have promoted this idea of fixing this issue. And if you are not interested in getting it fixed, they will not work with you. So, and it's gotten to the point now where states have literally outlawed. They've had to pass laws against conversion therapy because it is psychologically damaging to the client to try and force them to go through these conversion therapies. Counselors must have the ability to work with a range of clients with diverse worldviews and values. Counselors may impose their values either directly or indirectly. Value imposition refers to counselors directly attempting to define a client's values, attitudes, beliefs, and behaviors. It is unethical for counselors to impose their values in the therapeutic relationship. If you are a certain religion and your client is seeking spiritual salvation, it is unethical for you to push them in one specific direction. It is better to promote all directions as options. Therapy ought to begin with the exploration of the client's expectations and goals. The initial interview can be used most productively to focus on the client's goals or lack of them. Begin by asking questions: what do you expect from counseling? Why are you here? What do you want? What do you hope to leave with? It is important to cooperatively discover what this person is expecting from the relationship. It is the client's place to decide on the goals of therapy. Culture is the values and behaviors shared by a group of individuals. It is important to realize that culture refers to more than ethnic or racial heritage. Culture also includes factors such as age, gender, religion, sexual orientation, physical and mental ability, and socioeconomic status. So, for example, somebody who was born in the 1960s is going to have their own culture because they came of age, they were teenagers in the 80s. Whereas somebody who was born in the 1990s, they are coming of age in the aughts, and they're going to have a different culture. They grew up in the era of the internet, so they're having a much different experience growing up. Part of the process of becoming an effective counselor involves learning how to recognize diversity issues and shaping one's counseling practice to fit the client's worldview. It is an ethical obligation for counselors to develop sensitivity to cultural differences if they hope to make interventions that are consistent with the values of their clients. The therapist's role is to assist clients in making decisions that are consistent with their worldview and not to live by the therapist's values. Effective counseling must take into account the impact of culture on the client's functioning, including the client's degree of acculturation, which is the process of adopting the cultural traits or social patterns of another group. So, for example, you have someone who is a middle-class white kid, Caucasian kid from the suburbs, and they have moved to an urban area, and now they are putting on the auspices of trying to act like an inner city kid. You know, they're trying to use the language, the lingo, wear the clothes, and you have to understand that this acculturation is a choice for this client and not just this idea of them trying to fit in. It is a choice that they're trying to make for themselves. Counselors from all cultural groups must examine their expectations, attitudes, biases, and assumptions about the counseling process and about persons from diverse groups. Everyone has biases, but being unaware of the biased attitudes we hold is an obstacle to client care. Effective counselors believe cultural self-awareness and sensitivity to one's own cultural heritage are essential for any form of helping. It is vital to examine and understand the world from the vantage point of your clients. You must become comfortable with differences between yourselves and others in terms of race, ethnicity, culture, and beliefs. Additionally, you must realize that traditional theories and techniques may not be appropriate for all clients or for all problems. Culturally effective practitioners possess certain knowledge, especially the dynamics of oppression, racism, discrimination, and stereotyping. They understand the worldview of their clients, and they learn about their clients' cultural background. They do not impose their values and expectations on their clients from differing cultural backgrounds, and they avoid stereotyping their clients. They are aware of the institutional barriers that prevent minorities from utilizing the mental health services available in their communities. And they possess knowledge about the historical background, tradition, and values of the client populations with whom they work. In areas where they are lacking in knowledge, they seek resources to assist them. Especially in the United States, we have to deal with the fact that there has been institutionalized racism, and as such, we have to understand that different races in this country have had different experiences. So a white kid from the suburbs who gets caught with alcohol is going to get a fine, a slap on the wrist, and a misdemeanor, whereas a black kid from the urban area who gets caught with marijuana may end up spending a few days in jail or even having a felony record for intent to distribute. The reality is that we as a society have created these laws despite the fact that there's no sense behind them. Alcohol causes more deaths than marijuana, and the research shows that alcohol is a gateway drug to just about every other drug, and yet it is not treated as severely. So we as a society have created this institutionalized situation where black kids are punished more severely. Culturally sensitive practitioners modify and adapt their interventions to accommodate cultural differences. They are able to send and receive both verbal and nonverbal messages accurately and appropriately. They are willing to seek out educational, consultative, and training experiences to enhance their ability to work with culturally diverse client populations. Incorporating culture into the therapeutic process is not limited to working with clients from a certain ethnic or cultural background. It is critical that therapists take into account the view and background of every client. So now we're going to talk about some of the issues faced by therapists who are starting out in the field. First, dealing with anxiety. Every client that comes in is a new face, and you're dealing with new issues, and it's always this question of, do you know what you're doing? Then being yourself and the issue of authentic self-disclosure. If we are able to be ourselves in our therapeutic work and appropriately disclose our reactions in counseling sessions, we increase the chances of being authentic. It is this level of genuineness and presence that enables us to connect with our clients and to establish an effective therapeutic relationship with them. Being genuine is one of the most important aspects for any therapist, and a client can tell if you are superficial or if you are sincere. Avoiding perfectionism and being honest about your limitations. It takes honesty to admit that you cannot work successfully with every client. It is important to learn when and how to make a referral for clients when your limitations prevent you from helping them. The reality is that not every client who comes to see you will benefit from your therapeutic interventions. Sometimes they need more help than you can provide. And you have to be willing to accept and reveal that information to the client. Understanding silence. This is a big one, especially in the United States, because we don't like silence. It can have many meanings. Clients may be thinking, maybe waiting for the therapist to take the lead, or the therapist may be waiting for the client to do this. When silence occurs, acknowledge and explore with your client the silence. Why are you thinking? What are you thinking about? Etc., etc. Dealing with demands from clients. Some clients seem to make constant demands, and they can manifest themselves in a variety of ways. such as wanting to see you for a longer period than you can provide, wanting to see you socially, expecting you to continually demonstrate how much you care, or demanding that you tell them what to do and how to solve a problem. One way of heading these demands is to make your expectations and boundaries clear during the initial counseling sessions or in the disclosure statement. However, there are some people who are just very codependent, and they're going to transfer their codependency from whomever they are codependent on currently to their therapist. And you have to watch out for those kinds of issues and be aware that when a client becomes overly dependent upon you, that is taking you into a sticky situation. Tolerating ambiguity. It is often difficult to know for sure whether your client is improving, at least during the initial sessions. Realizing clients may seemingly get worse before they show therapeutic improvement. Sometimes improvements may manifest themselves after the conclusion of therapy. So if a client may see you for 6 or 7 months, you conclude therapy, and a year later you see them on the street and they are just as happy as anything. They're like, oh, I learned so much, blah, blah, blah. You have to develop a sense of humor. A therapist without a sense of humor is like a firefighter who's afraid of water. It's not going to work. Both clients and counselors can enrich a relationship through humor. There are times when laughter is used to cover up anxiety or to escape from the experience of facing threatening material. The therapist needs to distinguish between humor that distracts and humor that enhances the situation. Sharing responsibility with the client. How responsibility will be shared should be addressed early in the course of counseling. It is your responsibility to discuss specific matters such as length and overall duration of the sessions, confidentiality, general goals, and methods used to achieve goals. Not doing so can increase the likelihood of your early burnout. And that is to defining your role as a counselor. The central function of counseling is to help clients recognize their own strengths, discover what is preventing them from using their resources, and clarify what kind of life they want to live. In this framework, counselors provide support and warmth, yet care enough to challenge clients so that they will be able to take actions necessary to bring about significant change. Professional roles you assume are likely to be dependent on factors such as the client populations with whom you are working, the specific therapeutic services you are providing, the particular stage of counseling, and the setting in which you work. Developing your own counseling style. Your counseling style is going to be influenced by your teachers, therapists, and supervisors, but don't blur your potential uniqueness by trying to imitate them. Borrowing from others, yet at the same time doing it in a way that is distinctive to you. So over time, you're going to take a little bit from this instructor, a little bit from this theory, a little bit from this book or research that you read, and you're going to create your own method, your own style that will work for you. Dealing with clients who lack commitment. Involuntary clients who may be required by a court order to obtain therapy can be very challenging. It is possible to do effective work with mandated clients. It is a good practice to make clear the scope of confidentiality. So if they know that what they say is kept in confidential quarters, they may open up and really begin to deal with the issues that they are dealing with and why they may be self-medicating with alcohol or drugs. Declining to give advice. Therapists must help clients discover their own solutions and recognize their own freedom to act. Our task is to help clients make independent choices and accept the consequences of their choices. Maintaining your vitality as a person and as a professional. Ultimately, your single most important instrument is the person you are, and your most powerful technique is your ability to model aliveness and realness. It is of paramount importance that we take care of ourselves, for how can we take care of others if we are not taking care of ourselves? And that is so true in so many different ways. Which leads to the discussion of professional burnout. You have considerable control over whether you become burned out or not. You cannot always control stressful events, but you do have a great deal of control over how you interpret and react to these events. Self-monitoring is a crucial first step in self-care. Such an awareness can provide the basis for retaining your physical and psychological vitality and for being an effective professional. Self-care is not a luxury, it is an ethical mandate. If we neglect to care for ourselves, our clients will not be getting the best of us, which really is counterintuitive to why we spend all of our time becoming therapists. So, if you have any questions, please feel free to email or text me. If you're not in my class, please leave a comment and I will attempt to answer your question as quickly as I can. Thank you and have a great day.